Every year, hundreds of people die from a virus that leaves no warning. It has no cure, no vaccine, and it may be living just a few feet from your pet. Today, you will learn everything you need to know about hantavirus and why pet owners are at a higher risk than anyone else. Hantavirus pulmonary syndrome kills nearly 4 out of every 10 people it infects. That is a 38% fatality rate, higher than most diseases that make international headlines. Yet most people have never even heard of it. That changes today. Hantavirus is a family of viruses carried by wild rodents, primarily deer mice, cotton rats, and field mice. The virus lives in their urine, droppings, and saliva. It does not need a bite to infect you. The most common route of infection is breathing in contaminated dust. Dust that forms when dried rodent droppings or urine are disturbed. Think about what happens when you sweep a garage, clean out a shed, or open a storage box that has been untouched for months. Dust rises. If rodents have been there, that dust may carry the virus. Breathing just a few particles can be enough. This is why farm workers, campers, and people who work in or around barns are considered high risk, and why pet owners who let their animals roam outdoors belong on that list too. Hantavirus causes 2 main diseases. The first is Hantavirus pulmonary syndrome, or HPS. This is the type most common in the Americas. It attacks the lungs. Fluid builds up rapidly in the lung tissue. Breathing becomes progressively harder. In severe cases, the lungs effectively drown from the inside. This is the disease with that 38% death rate. The second disease is hemorrhagic fever with renal syndrome, or HFRS. This is more common in Europe and Asia. Instead of the lungs, this form attacks the kidneys. Patients experience fever, bleeding, and kidney failure. Both forms are dangerous. Both are caused by the same family of viruses, and both come from rodents. Here is the question every pet owner needs answered. Can my dog or cat get hantavirus? Scientific studies have found antibodies in dogs and cats living in endemic areas, which means they were exposed to the virus. But here's the key finding. They did not develop the disease. Dogs and cats do not appear to get sick from hantavirus. They are resistant to its disease effects. But here is where the real danger begins. Your dog does not get sick, but your dog goes outside. Your dog chases mice. Your dog rolls in fields where rodents have been. Your dog brings that contaminated material back to you, on its fur, on its paws, in its mouth. You pet your dog. You pick up a dead mouse your cat left near the door. You are now exposed. Your pet is not the victim. Your pet is the bridge. People most at risk are those whose pets have access to fields, farms, barns, or wooded areas. If you have an outdoor cat that hunts, if your dog roams near tall grass or abandoned buildings, if you live in a rural or semi-rural area, if you clean your pet's space without gloves. Any of these situations puts you in a higher risk category. Hantavirus does not announce itself clearly. The incubation period is anywhere from 1 to 8 weeks after exposure. Early symptoms look identical to influenza: fever, chills, muscle aches in the thighs and back, headache, fatigue, and nausea. Many people dismiss these as a common cold. That is exactly what makes this disease so dangerous. By the time it reveals itself, it may already be too late to respond effectively. Then, typically 4 to 10 days after the first symptoms, the disease turns. Breathing becomes difficult. The lungs fill with fluid. The patient often cannot breathe without mechanical support. This is the stage where most deaths occur. It can move from mild flu symptoms to critical respiratory failure within 24 to 48 hours. Time is not on your side. Prevention starts with how you handle rodents. If your pet brings in a dead mouse or rat, never touch it with bare hands. Put on rubber or latex gloves. Spray the rodent and the area around it with a 10% bleach solution. That is 1 part bleach to 9 parts water. Let it soak for at least 5 minutes. Then pick it up with gloved hands, seal it in a plastic bag, and dispose of it in an outdoor bin. If you find rodent droppings in a space your pet uses, the kennel, the stable, the yard, do not dry sweep or vacuum them. This launches the virus particles directly into the air. Instead, spray the area thoroughly with disinfectant first. Let it sit. Then wipe with a cloth or damp paper towels. Always dispose of the cloth immediately after. Rodents enter your home through holes as small as a coin. Check the areas around pipes, the foundation walls, vents, and gaps under doors. Use steel wool or wire mesh to block these entry points. Rodents cannot chew through metal. Reducing rodent access to your living space directly reduces your risk. If you keep animals, store all feed in sealed metal or hard plastic containers. Rodents follow food. If there is no accessible food source, they move on. And after any contact with animals in rodent risk areas, wash your hands thoroughly before touching your face, your food, or your family. If you believe you have been exposed to rodents or rodent-contaminated material, and you begin to develop flu-like symptoms, do not wait. Go to your nearest hospital or clinic immediately. Tell the doctor exactly these words. I may have been exposed to hantavirus through rodent contact. Give them the date, location, and how the exposure may have happened. There is no specific antiviral cure, but early supportive treatment, oxygen, fluids, intensive care dramatically improve survival. The earlier you go, the better your odds. Hantavirus does not get the attention it deserves. It is silent, it is fast, and it is deadly. But it is also entirely preventable. As a pet owner, your responsibility is bigger than you may have realized. The animals you love can unknowingly bring danger to your door, not because they are sick, but because they are part of your world, and rodents are part of theirs. Know the risks, take the precautions, and share this with every pet owner you know. If this video helped you, please share it with a fellow pet owners. Like, share, and subscribe to Tales of Veterinary Medicine for more videos like this.